new COVID strains have been found in China and the United Kingdom. The World Health Organization defines this as, or designates this as, the XE variant. That is a recombinant of BA1 and BA2. Those are Omicron, so it's a recombinant of that. The World Health Organization says that XE may be 10% more transmissible than what we've seen in some of the strains of Omicron. In China, the new subtype of Omicron has been detected. It's called BA1.1. China says the mutation has been detected in a province bordering Shanghai. So just how serious is this? And it really does beg the question, boosters for all adults. When are we going to actually get it in our country, if that offers some sort of additional protection? Joining us, Shashank Joshi, member of the COVID-19 Task Force in Maharashtra, and Dr. Rajiv Dasgupta, member of the National Adverse Effects Following Immunization Committee, chairperson of the Center of Social Medicine and Community Health at JNU. Thank you both very much for being with us. Dr. Shashank Joshi, how do you assess these new variants of COVID? This XE variant, is it a matter of time before it gets here?
So, Vishnu, the XE variant from UK, the UK database with 600 plus cases has shown that it is not, it may be more transmissible, but Omicron also was more transmissible, but the virulence is unknown. So currently the data is not very clear, but it appears to be still a nose and a throat COVID and not a lung COVID. So that is a reassuring sign. My bigger worry is the variant from China, because China is a possibility like Omicron, like new variant will come. But if you see the evolution of viruses, normally when a virus evolves after 2 years, and if you look at Spanish flu, it is likely that even if it is more transmissible, the virulence is likely to be less. Of course, this is speculation right now, but we need to be still vigilant. And these are fastly transmissible airborne droplet strains. India is sitting pretty because we have had the same BA2.
Right.
And the other thing is, whatever we know from HIV, the recombinants of HIV never really spread across. And that is something which we know from old anecdotal data or evidence-based data. So from a science standpoint, though there are causes of concern and vigilance, we cannot afford to dismiss it. The XE variant from UK, I'm not as much worried as I'm worried from the Shanghai variant. But we need to be on the vigil. India for next 3 to 6 months, it's unlikely that a major variant of concern will disrupt currently.
Okay. Dr. Dasgupta, is that also your concern, what's being discovered now in Shanghai? What is the science of this strain?
Thank you. That's most likely to be the picture. Also, the fact that large number of cases continue to be reported across the globe means that recombinant forms will appear and will spread in some countries or across some regions. But to put it in current context, in the 29th March WHO situation report, the Southeast Asian region also shows a negative trend of new cases. Of course, it is in the rise in UK, for example, but a new report shows that while prevalence is on decline, which means old cases plus new cases, the incidence is on rise, which means the new cases are rising, but overall it means that the COVID load is coming down. Plus add to the fact that whether it's Omicron or now XE, which is BA1 and BA2 recombinant, it has certainly affected the large urban districts or urban centers primarily, or certainly at the early stages.
Right.
And that's something large megacities in India and developing world in general need to look out for.
Okay. Dr. Joshi, what about boosters now for all adults? Is it time that we move to that?
Vishnu, the booster data from India is yet awaited. For people whose immunity is compromised or immunocompromised frontline healthcare, giving a precautionary dose is reasonable. But remember, a large Indian population has already got exposed,
right,
either to the Delta variant or to the Omicron variant.
Right.
So there is a large natural exposure as well. We are awaiting our sero surveys. So I don't think we should rush for boosters for all. We must complete our primary immunization correctly and appropriately, and wait for some better Indian science to be generated on the boosters.
Okay.
Because we have seen in Israel that when they have given 4 boosters also, they still have seen large spikes. So I'm not so certain about the booster science. And I think therefore Indian government has been very correct in using the word that precautionary dose for people who are vulnerable, people who are immunocompromised, or people who are at frontline or at healthcare space.
Okay.
And those spaces definitely need more attention.
Dr. Dasgupta, do you share that view that we don't need boosters right now?
That has by and large been the thinking. However, the new variants the number of new cases will depend on their immune escape properties. But what is certainly encouraging so far is that vaccines have been able to prevent serious disease, hospitalization, death, etc. And that's something that we continue to witness both through the largely through the Omicron phase, which is called decoupling, that cases increase, but deaths and hospitalizations decrease. Even with the early indication of XE in the UK, the decoupling reasonably seems to hold. The important point is protecting the immunocompromised, not just adults, but immunocompromised children also. This includes children with blood cancers, Down syndrome, or organ transplants, and so on. And that's something on which clarity is required. The other element for which clarity is, and certainly advisory is required for booster doses, is international travel. Now that the Indian international travel schedule has completely opened up, that's something which is quite a priority.
Absolutely, you can't travel to so many countries now without having a booster dose.
Yeah, but there's a catch there. Now, in general, international vaccine requirements are mandated by the WHO.
Right.
For example, for yellow fever, the countries that are relevant, the same rule holds. But what's happening in COVID is different countries are coming up with different rules.
That's absolutely.
Somewhere WHO needs to step in and have a uniform global
absolutely, sir.
regime.
So I just need to wrap this up. I'm running short on time. Professor Devi Sridhar also waiting to join us in a little while from now. A couple of quick comments coming in on coup. Will a booster help to fight the new COVID strain? China is really struggling. Atul says we can't turn a blind eye to COVID. We need to get booster doses as soon as possible. Well, earlier today I spoke to Professor Devi Sridhar, Professor and Chair of the Global Public Health at the Edinburgh University's Medical School, on what this new British subvariant actually was. Here's what she told me. Thank you, Devi, very much for being with us. We've always spoken about how mutations are bound to take place. In terms of this particular mutation, the one that we are seeing in the United Kingdom and the one that's now being reported in China, are they essentially the same?
Yeah, I think right now WHO is saying this is not a variant of concern yet. It is similar to Omicron. The main issue is it looks like it's more transmissible, estimates about 10% more transmissible, which is why we are seeing this surge in cases everywhere in the world, including here in Britain, as well as in China and other places too.
That's actually quite frightening in a sense, because Omicron was horrifically transmissible, fortunately not as dangerous as Delta. To have something even more transmissible, what do we know about the science or the way this particular strain moves or attaches itself, which part of the cell?
Well, I think what we're seeing is that there are multiple ways that this can enter the cell and in different parts of the body, which is why we are seeing it being able to reproduce and also shed onto other people. The real message to everyone from a public health perspective is that this virus will find you. Right. It is pretty impossible to avoid it. So make sure you're vaccinated. If you can, get a booster so that when you are exposed, you're protected against the really harsh impacts it can bring as a disease.
It's now been a couple of months around the world that we've seen Omicron, and so many millions of people around the world would have had Omicron, and most of them would have gotten better. Is there science now on the efficacy of the existing vaccines against Omicron? I ask this because that would also be particularly relevant with the newer strains.
Yeah, so the great news with this new strain is that it looks like vaccines are just as effective in terms of preventing severe disease and death. And so if you are vaccinated, you have the same protection against this new variant. If you have been vaccinated, you do not need a new vaccine or a different vaccine. So that is good news. But on the flip side, it is causing a wave. It is finding people that, let's say, are vulnerable or elderly or who are more cautious. And that is presenting challenges for hospitals, because those people we know, even being fully vaccinated, might still have to go into hospital for some support.
And is that what you're seeing in the United Kingdom in terms of numbers? Once again, are hospitals are seeing a larger number of people going in?
Yes, unfortunately. So here in Scotland, our wave of hospitalizations is the highest it's ever been. But fortunately, people are recovering. So our death rates are much lower. People are staying shorter stints in hospital too and not going into ICU. The ICU pressure isn't there. It's more general hospital pressure. The other thing we're seeing is very high rates, 1 in 12, one in 11, one in 13. These are surveys done in the community where they go and they test randomly to try to get a sense of how much virus is there. And those are showing probably the highest levels we've ever had across Britain. And now we're hoping in the weeks ahead, maybe that might tailor off and we'll start to see a decline.
Are we seeing reinfections as well?
Yes, unfortunately, we're seeing people getting it 2 times, 3 times. There are unfortunately even, several dozen people who have been tracked having it 4 times. This is something that will get you again. The hope, though, is your symptoms will be milder, that you can manage it better. But yes, this is a virus that just because you have once doesn't mean you won't get it again. Usually it's a new variant. So people who had the wild type might have got Delta. People with Delta might have got Omicron. And even now we're seeing that people who have got Omicron might get a slight tailored different one. So yes, reinfections are happening.
And again, it's something we've discussed in the past, but I think it's relevant again. Where is the science as far as getting a new vaccine in terms of something which deals with the various variants which we've seen so far and perhaps deals with COVID in a more holistic manner? Is the science available to actually develop that silver bullet?
Well, so pharma companies have been very clear. They don't want to chase variants because if they chase Delta, it'd be too late by now. If they chased Omicron, who knows what we're going to have in a few months. So they've said we actually want to get ahead of it. And I know Bill Gates through the Gates Foundation, Wellcome Trust are trying to work towards a sterilizing vaccine. That is a vaccine that can mean that once you're vaccinated, you cannot get infected. It's what we have against measles, mumps, rubella, a number of other diseases. And that's kind of the big prize now in the next 6 to 8 months. They're hoping, can we reach that goal? Or with this, does it mutate too much? And so does that mean that we'll always be chasing it a bit like the flu, where we try to match and predict what flu strain will be circulating? Some years we get it right. Some years the efficacy is a bit lower.
And what are the signs so far as the science is concerned of this sterilizing vaccine?
Well, it seems like it's very difficult. No teams are very close to it. It seems like most vaccines across the world, whether it's the Chinese vaccines or Russian, are good against severe illness, but stopping infection seems to be a big problem with the virus that mutates so much. And also because it's circulating across the world. All it takes is for this to circulate somewhere in Latin America or, in the Pacific or East Asia, and you get a new variant. And that kind of puts you back in terms of your vaccines. It's not as stable, let's say, as the measles virus. And so that's the real difficulty now. Of course, science has come a long way, but that's kind of the prize. They're saying, can we do something we haven't been able to do before? But there's no early results yet we can point to say we might have that next.
All right, Devi, thank you very much for speaking to us. Once again, sounding caution. I think that we just need to be careful about this. It's not going away anytime fast. Thank you very much indeed, Devi, for being with us.
Thank you.